This is Chapter 16, Medical Overview. Your national competencies for medicine applies the fundamental knowledge to provide basic and selected advanced emergency care and transportation based on assessment findings for an acutely ill patient. The medical overview covers assessment and management of a medical complaint, the pathophysiology assessment and management of medical complaints to include transport mode and destination decisions. We'll also talk about infectious diseases, awareness of a patient that may have an infectious disease, assessment and management of a patient who may have an infectious disease. A patient who may be infected with a bloodborne pathogen. This will cover things like HIV and hepatitis B, antibiotic-resistant infections, and current infectious diseases prevalent in the community. All right. Patients who need EMS assistance generally have experienced a medical emergency, a trauma emergency, or both. Trauma emergencies involve injuries resulting from physical forces applied to the body. Medical emergencies involve illnesses or conditions caused by disease. Patients may have a combination of medical and trauma conditions affecting their health. Types of medical emergencies. Respiratory emergencies occur when patients have trouble breathing or when the amount of oxygen supplied to the tissues is inadequate. Diseases that can lead to respiratory emergencies include asthma, emphysema, and chronic bronchitis. Cardiovascular emergencies are caused by conditions affecting the circulatory system. Common examples include myocardial infarction and heart failure. Neurologic emergencies involve the brain. This may be caused by a seizure, stroke, or fainting, which is a syncopal episode. A GI emergency includes appendicitis, diverticulitis, and pancreatitis. Urologic emergency can involve kidney stones. The most common endocrine emergencies are caused by complications of diabetes. Hematologic or blood-related emergencies may be the result of sickle cell disease or various types of blood clotting disorders such as hemophilia. Immunologic emergencies involve the body's response to foreign substances. Allergic reactions are a type of immunologic medical emergency that results when a body overreacts to a foreign substance. They can range from fairly minor conditions to life-threatening anaphylaxis. Toxicologic emergencies include poisoning and substance abuse. These result in other types of medical emergencies. Psychological and behavioral emergencies may be especially difficult to manage because patients often do not present with typical signs and symptoms. Conditions such as gynecologic conditions will most likely be challenging for you because there's little you can do to treat patients in the pre-hospital setting. Your patient assessment. Assessment of a medical patient is similar to assessment of a trauma patient, but with different focus. Medical patient assessment focuses on the nature of illness or the NOI, the symptoms, and also the patient's chief complaint. Information received from dispatch can be helpful in anticipating what you might find when you arrive on the scene. A traumatic emergency can be a medical emergency or vice versa, and tunnel vision may cause you to miss an important injury or illness, so it's very important to avoid that situation. For your scene size up, always ensure the scene is safe. Follow standard precautions when you respond to an emergency. After determining the number of patients needing assistance and considering whether you need additional help, determine the NOI. Evaluation of the NOI for a medical patient will provide you with an index of suspicion. An index of suspicion is your awareness and concern for potentially serious underlying and unseen injuries or illness. Your primary survey, you'll form a general impression. Keep in mind that conditions of many medical patients may not appear serious at first. Determine the patient's level of consciousness using the AVPU scale. Identify life threats by quickly assessing the patient's airway, breathing, circulation, disability, and exposure. In responsive patients, ensure the airway is open and that breathing is adequate. Consider applying oxygen if breathing has been affected. For unresponsive patients, make sure to open the airway using the proper technique and take several seconds to evaluate their breathing. Unresponsive patients may need airway adjuncts and ventilatory assistance with a BVM. Quickly assess the circulation by checking the radial pulse in a responsive patient, checking the carotid pulse in an unresponsive patient, and by observing the patient's skin color, temp, and condition. Quickly glance around the patient to identify any life threats such as severe bleeding or injury to the chest. Patients who should be considered in serious condition and are in need of rapid transport include patients who are unresponsive or who have altered mental status, patients with airway or breathing problems, and patients with obvious circulation problems such as severe bleeding or any signs of shock. History taking. Investigate the chief complaint. History taking may be the only way to determine what the problem is or what may be causing the problem. This may include both a history of present illness and a medical history. Investigate the NOI by asking questions about the chief complaint and obtain a sample history. Sample again stands for signs and symptoms, any allergies, medications, pertinent past medical history, the patient's last oral intake, and the events leading up to this situation. You're going to use the OPQRST questions to obtain the history of the present illness. That mnemonic stands for onset, provocation, and palliation. The quality, which is how they describe the pain. Is it pressure? Is it sharp? Is it stabbing? Things like that. Radiation, severity, and time. Ask follow-up questions, record any allergies, medical conditions, and any medications that the patient takes. Ask if patients are compliant with their drug regimen. Look around the scene for evidence that may also help you determine the history of the patient. If the patient is unresponsive, try to obtain as much of the patient's medical history as possible from family members, friends, or bystanders, or from the scene itself. Your secondary assessment is designed to identify any signs or symptoms of illness or injury that were not found during the primary survey. Secondary assessment may occur on scene or en route to the emergency department. If the patient is critically ill or injured, or the transport time is short, you may not have time to conduct a secondary assessment. Responsive medical patients may not need a full body exam, but perform a limited or focused assessment based on their chief complaint. Obtain a baseline set of vital signs. Consider using the automatic blood pressure cuff for future assessments at regular intervals after first obtaining a manual reading. Depending on your local protocol, consider obtaining a blood glucose level and a pulse oximetry reading. End-tidal carbon dioxide monitoring should be considered if the patient complains of respiratory problems or if you suspect a stroke. Any patient who has a cardiac-related symptom should be placed on a cardiac monitor. Reassessment. Once the assessment and treatment have been completed, reassessment should begin and continue throughout transport. Repeat the primary survey and reassess the chief complaint. Look for any changes in the level of consciousness, reassess the patient's vital signs, re-examine the transport decision, reconsider the need for paramedic backup. Review all treatments that have been performed and ensure that they are still effective. Document any changes that have developed as a result of the treatments, and if needed, adjust any of the treatments. Alert the ED before arrival of potentially critical patients. You're going to alert the ED for arrival of all patients. But critical patients, or if you have a change in status, let's say you call report and the patient's stable, but then something happens during transport, make sure that you re-alert them to let them know that you now have a critical patient. Management, transport, destination. Most medical emergencies require a level of treatment beyond that is available in a pre-hospital setting. The patient may require advanced testing available in a hospital. Primary pre-hospital treatments address the symptoms more than the actual disease process. Administration of medications that are stored in the ambulance is limited for advanced EMTs. Any administration of medication by an advanced EMT requires direct permission for medical control. Written protocols may allow the administration of certain medications without calling for online medical control. Complete a thorough assessment of the patient before calling medical control for permissions. Advanced EMTs can use an automated external defibrillator or an AED on a patient who is pulseless and apneic. In some cases of cardiac arrest, immediate treatment with an AED may provide the best option to resuscitate the patient. Your scene time. This may be longer for medical patients than for trauma patients. Gather as much information as possible from the scene to transmit to the emergency department. Critical patients always need rapid transport. They include patients with altered mental status, airway or breathing difficulties, any signs of circulatory compromise, or patients who are very old or very young. Type of transport. If a life-threatening condition exists, the transportation should include lights and sirens. If the patient is not critical, consider non-emergency transport. Modes of transport ultimately come in one of two categories, ground or air. Ground transport EMS units are generally staffed by advanced life support providers, which are AEMTs or paramedics, and an EMT. Air transport EMS or critical care transport units are generally staffed by critical care nurses and critical care paramedics. Destination selection. Generally, the closest hospital with an emergency department should be your destination. At times, the patient will benefit from going to another hospital that is capable of handling his or her condition. If the patient experiences cardiac arrest during transport, immediately reroute to the closest hospital with emergency facilities. Contact medical control when unsure. Some patients may benefit from on-scene treatment provided by paramedics. Infectious diseases. An infectious disease is a medical condition caused by growth and spread of harmful organisms within the body. A communicable disease is a disease that can be spread from one person or species to another. General assessment principles. Approach the patient with an infectious disease like you would any other medical patient. Size up the scene and take standard precautions. Perform the primary survey and history taking. Typical chief complaints include fever, nausea, rash, pleuritic chest pain, and difficulty breathing. Remember, when we say pleuritic chest pain, we're talking about pleural pain that involves the lungs. So that's situations where you have inflammation in the lungs or the chest wall, that when patients take a deep breath, those linings rub together and cause pain. And that's why a lot of times you will ask the patient, especially if they're talking about chest pain, if you take a deep breath, does that make that pain worse? That's an indication of that being a pleuritic pain. Focus on any life-threatening conditions identified in the primary survey. Be empathetic. Place the patient in a position of comfort on the stretcher and keep them warm. Follow standard precautions. Always follow your agency's exposure control plan in cleaning equipment and properly discard any disposable supplies as well as linens. All right, epidemics and pandemics. An epidemic occurs when a new case of a disease in a human population substantially exceeds the number expected based on recent experience. So epidemics are going to be a local condition. A pandemic is an outbreak that occurs on a global scale. So an epidemic is just an even bigger pandemic that goes from a local confinement to a global spread. Common or serious communicable diseases, human immunodeficiency virus or HIV infection, and acquired immunodeficiency syndrome, which is AIDS. It was first identified in the late 1970s. According to the U.S. Centers for Disease Control and Prevention, or the CDC, more than 1.2 million people in the U.S. are infected with this virus. Gay and bisexual men, particularly young African American gay and bisexual men, account for the majority of new diagnoses. HIV infection is a potential hazard only when deposited on a mucous membrane or directly into the bloodstream. It is primarily a sexually transmitted disease, but it is also a blood-borne disease. It can also be transmitted from a pregnant woman to her infant in the birthing process. HIV is also transmitted through blood transfusions. In a person with HIV infection, the entire immune system begins to fail, allowing life-threatening opportunistic infections to flourish. HIV pathogen envelops infected cells and attacks the immune system and other body organs. Many patients with HIV show no symptoms. If they do show symptoms, these signs and symptoms may include acute febrile illness, malaise, fatigue, sore throat, swollen spleen and lymph glands, headache, weight loss, and possibly a rash. Acquired immunodeficiency syndrome, AIDS, is the end-stage disease process caused by HIV infections. A patient with AIDS is extremely vulnerable to numerous bacterial, viral, and fungal infections that would not affect a person with an intact immune system. Pre-hospital management of HIV or AIDS is strictly supportive. No vaccine yet exists to protect against HIV or AIDS. Despite great progress in drug treatments, AIDS is still fatal. It is not easily transmitted in the EMS work setting. It is far less contagious than hepatitis B. Your risk of infection is limited to exposure to an infected patient's blood or body fluids. Because many patients who are infected with HIV do not show any symptoms, always take precautions to prevent infection, including always wear the proper type of gloves, take great care in handling and disposing of needles and scalpels, cover any open wounds that you have whenever you are on the job, practice good hand washing technique, and routine ambulance cleaning after transport. If you have any reason to think that a patient's blood or secretions may have entered your system, seek medical advice as soon as possible. Influenza, or the flu, is primarily an animal respiratory disease that has mutated to infect humans. Those with chronic medical conditions, compromised immune systems, or the very young or the very old are particularly susceptible. This is transmitted by direct contact with nasal secretions, aerosol droplets from coughing, sneezing by infected people. The H1N1 virus, initially identified as swine flu in 2009, is a specific form of influenza. General treatment includes supportive treatment. Influenza and other potentially serious diseases can be passed by the respiratory route. Wear your personal protective equipment. Frequent hand washing is important. Maintain your vaccinations. Place a surgical mask on patients with respiratory disease. Wear a HEPA respirator during any aerosol generating procedures. And that's going to be anything that's nebulized, primarily albuterol. If you're using high flow oxygen, an army breather, or a BVM, those generate aerosol droplets. Also, an annual influenza immunization is important, especially for EMS personnel, to protect both providers and patients. Hepatitis. And this is inflammation and often infection of the liver. It can be caused by a number of different viruses and toxins. Complications of hepatitis include scarring of the liver, liver cancer, and liver failure. According to the CDC, hepatitis C accounted for the highest mortality rate in the United States in 2014 of the three types of viral hepatitis. Depending on severity, patients with hepatitis may be asymptomatic or may have a variety of signs and symptoms. Early signs include loss of appetite, nausea and vomiting, fever, fatigue, sore throat, cough, muscle and joint pain. Several weeks later, they may appear jaundiced, which is yellowing of the eyes and skin, and they may have right upper quadrant abdominal pain develop. Management of patients with any type of hepatitis is strictly supportive. There is no sure way to tell which hepatitis patients are contagious. Toxin-induced hepatitis is not contagious. A carrier is a person or animal in whom an infectious organism has taken up permanent residence and may or may not cause an active disease. Carriers may never know that they harbor the organism, but they can infect others. Table 16.2 lists the characteristics of different types of hepatitis. Hepatitis A is transmitted orally through oral or fecal contamination. Organisms that cause hepatitis B, C, and G are transmitted through vehicles other than food or water. Virulence is the strength or ability of a pathogen to produce disease. Hepatitis B is far more contagious than HIV. Vaccination with hepatitis B vaccine is highly recommended for advanced EMTs. Not everyone who is vaccinated develops immediate immunity to the virus. You should seek testing after vaccination to determine your immune status. Herpes simplex is a common virus strain carried by humans. More than 85% of people carrying the virus are asymptomatic. Symptomatic infections cause eruptions of tiny fluid-filled blisters called vesicles that often appear on the lips or genitals. Herpes simplex can cause serious illnesses like pneumonia and meningitis in the very young, very old, and immunocompromised patients. The primary mode of infection is through close personal contact. Standard precautions are generally sufficient to prevent spread to or from healthcare workers. Syphilis. Although syphilis is commonly thought of as a sexually transmitted disease, it is also a blood-borne disease. There is a small risk of transmission through contaminated needle stick injury, direct blood-to-blood contact. The initial infection with syphilis produces a lesion called a canker. Cankers are most commonly located in the genital region. That was the slide that last part was supposed to go to. Apparently didn't change my slides, but there you go. Meningitis, inflammation of the meningeal coverings of the brain and spinal cord. Signs and symptoms include fever, headache, stiff neck, and altered mental status. The stiff neck symptom can be so severe that one of the things that they ask you to do when they're evaluating for meningitis is touch your chin to your chest, because in patients that have a meningitis infection, it causes severe pain to make that movement, so they're not able to touch their chin to their chest. They have to do a spinal tap to confirm the diagnosis for those. That's also very painful. This can be caused by viruses or bacteria, most of which are not contagious. However, one form, meningococcal meningitis, is highly contagious. Only laboratory tests can sort out the different forms of meningitis. And this you will see a lot of times in the younger school-age children. And they'll spread it very rapidly at school. Take standard precautions. Wearing gloves and a mask will go a long way to prevent the patient's secretions from getting into your nose and mouth. Vaccines are rarely used. Meningitis can be treated at the emergency department with antibiotics. After treating a patient with meningitis, contact your employer health representative. In many states, meningitis is reportable. In such states, you may be contacted if one of the patients you handled is diagnosed with meningitis. Tuberculosis is a chronic mycobacterial disease that usually strikes the lungs. Many infected patients are well most of the time. If the disease involves the brain or kidneys, the patient is only slightly contagious. This is a disease that occurs shortly after infection, and it's called primary tuberculosis. Reactive tuberculosis is common and can be much more difficult to treat, especially because an increasing number of tuberculosis strains have grown resistant to most antibiotics. Patients who pose the highest risk almost always have a cough. Consider respiratory tuberculosis to be the only contagious form because it is the only one that is spread by airborne transmission. Droplets produced by coughing are not the real problem, but rather the droplet nuclei. The droplet nuclei are the remnants of the droplet after the excess water has evaporated. N95 or HEPA masks are required to prevent the inhalation of droplet nuclei. For a patient with dyspnea, wearing a non-rebreathing mask oxygenates the patient while preventing the droplets from spreading to the advanced EMT. If the patient is not having difficulty breathing, place a surgical mask on the patient and a HEPA mask on yourself. Absolute protection from infection with the tubercle bacillus does not exist. Everyone who breathes is at risk. According to the CDC, 1/3 of the world's population is infected with TB. The vaccine for TB, called Bacillus calmette-guerin, that's how we're going to pronounce that, not quite sure, is only rarely used in the United States. The mechanism of transmission used by the M. tuberculosis is not very efficient. You should have TB skin tests performed regularly. If the infection is found before you become ill, preventative therapy is almost 100% effective. This is a fun fact, a little bit of history in Gadsden. So Mountain View Hospital, the psychiatric hospital in Gadsden, was actually built as a TB hospital when there was the tuberculosis outbreak, and they needed a place away from the community to confine these patients. And since it's an airborne disease, they thought that putting them high up on the mountain, away from the general population, was the best way to confine this. Back then, they didn't have the whole housing community that's located there now. But so there have been a lot of people that have died in that hospital from TB. I like to say the Midnight Society. Some of you aren't old enough to know what I'm talking about, but they like to say that the place is haunted and that there is a lot of residuals in the facility from patients that have died from having TB in that hospital. Some people say that it exacerbates psychiatric conditions of patients that are there now. Some people can walk into the hospital and immediately get a headache from the quote residuals that are left there. So just a fun fact, that's where Mountain View Hospital came from, why it developed, and why it's where it is. All right, pertussis, also known as whooping cough. This is an airborne disease caused by bacteria that previously affected children younger than 6 years of age. It's now becoming common in adults whose vaccination was years prior and whose immunity has decreased. Symptoms include fever and a whoop sound that occurs when the patient tries to inhale after a coughing attack. The best way to prevent infection from pertussis is to be vaccinated with a DTaP vaccine, and that covers diphtheria, tetanus, and a cellular pertussis. For added protection, place a mask on the patient and on yourself. Methicillin-resistant Staphylococcus aureus, or MRSA, is a bacterium that causes infections and is resistant to most antibiotics. Nosocomial infections with MRSA are believed to be transmitted from patient to patient by the unwashed hands of healthcare providers. Studies have shown that 1% to 5% of healthcare providers carry MRSA in their nares. So nosocomial and nares, this is referring to the nose. Okay, this is where MRSA colonizes, is inside your nose. To prevent MRSA transmission, use gloves and practice good hand washing techniques. Factors that increase the risk for developing MRSA include antibiotic therapy, prolonged hospital stays, a stay in the intensive care or burn unit, exposure to an infected patient. Incubation period for MRSA appears to be between 5 and 45 days. Exposure will not occur if you are in direct contact with wound drainage, but your skin is intact. No post-exposure treatment is recommended in case of true exposure, but the incident must still be documented. New and emerging diseases. The hantavirus is rare but deadly virus transmitted through rodent urine and droppings. It is not transmitted from person to person directly, but by a vehicle such as food or a vector such as rodents. The West Nile virus, the vector is the mosquito. It affects humans and birds. These diseases are not communicable and pose no risk during patient care. Severe acute respiratory syndrome, or SARS, is a serious, potentially life-threatening viral infection caused by a recently discovered family of viruses. SARS usually starts with flu-like symptoms and may progress to pneumonia, respiratory failure, and in some cases, death. It's transmitted by close person-to-person contact or by secretions. The avian, or the bird flu, is caused by a virus that occurs naturally in the bird population. It is carried in the intestinal tract of wild birds and does not usually cause illness. In domestic bird populations, such as chickens, ducks, and turkeys, it is very contagious. If an infected bird is used for food and is cooked, it does not pose a risk to those who eat it. Humans can get it when they have close contact with infected birds. No rapid human-to-human cases have been reported. The transmission risk for humans is low. Global health issues, Middle East Respiratory Syndrome coronavirus, or the MERS-CoV, most commonly found in bats and camels living in the Middle East. Cases of human infections have also been reported in Europe and in the United States. Symptoms include high fever, cough, muscle aches, vomiting, and diarrhea. Presently, no cure or vaccine is in place for this virus. If you suspect your patient might have MERS-CoV, place a surgical mask on him or her and notify the receiving facility. Ebola, incubation period is approximately 6 to 12 days after exposure. Symptoms may not begin to appear for as long as 21 days after infection. It includes watery diarrhea, vomiting, fever, body aches, and bleeding. The fatality rate can be as high as 70% if effective supportive treatment is not initiated promptly. The Zika virus. This is a vector-borne infection first noted in the U.S. in the mid-2015. It's transmitted by the bite of the Aedes aegypti mosquito. There is no vaccine for this virus. Prevention is aimed at protecting against mosquito bites. According to the CDC, most people infected with the Zika virus present with few or no symptoms. Symptoms of Zika include fever, rash, joint pain, and conjunctivitis. Other symptoms may include muscle pain or a headache. Symptoms are usually mild and last from several days to a week. The Zika virus can be diagnosed with a urine or blood test. Most significant complication affects pregnant women. The fetus is at risk for serious birth defects, including microcephaly. Other than the mother to the fetus, the most common route for human-to-human transmission is through sexual contact. The care is supportive. No recommendations for special protective equipment for medical personnel except to prevent person-to-person transmission through blood or body fluids. Travel medicine. Patients who acquire an illness from another country can present with a variety of symptoms depending on the illness. When you encounter an ill patient with a recent travel history, place a mask on the patient and gather as much information as possible. If you suspect the patient has a communicable illness, follow appropriate PPE precautions and notify the receiving facility. Important questions to ask the patient include: where did you recently travel? Did you receive any vaccinations before your trip? Were you exposed to any infectious diseases? Is there anyone else in your travel party who is sick? Which types of food did you eat? What was your source of drinking water? The assessment and treatment of medical patients can be very challenging. Medical patients' conditions may not be as readily apparent as in a trauma patient. The best approach is to keep calm, use your patient assessment skills, treat the patient's symptoms while maintaining a high index of suspicion for underlying problems, report to medical control, transport the patient safely to the closest and most appropriate facility. Keep in mind that patients sometimes have more than one isolated problem. And again, your best approaches are listed here. Apparently, they had a need for me to say it twice. So, this concludes your medical overview. And we will start detailed systemic overviews of each organ system following in this unit. So again, if you have any questions, reach out to us, read your book, listen to the lectures, do your study guides, and good luck.